Question 1. A 30-year-old G4P3 woman at 33 weeks gestation arrives at the emergency department reporting sudden onset of painless bright red vaginal bleeding that began while she was watching television. She denies contractions, abdominal trauma, or rupture of membranes. The fetal heart rate is 142 per minute with moderate variability. Her blood pressure is 110/68 mmHg, pulse is 96 per minute, and abdomen is soft and non-tender. The nurse reviews the prenatal record and notes that the placenta was identified as low-lying during the anatomy scan. Which nursing action is the priority at this time? A. Perform a sterile vaginal examination to determine cervical dilation. B. Prepare the client for immediate oxytocin induction. C. Avoid digital cervical examination and initiate continuous fetal monitoring. D. Place the client in high Fowler position and encourage ambulation. Answer: C. Avoid digital cervical examination and initiate continuous fetal monitoring. Rationale: the client is demonstrating classic signs of placenta previa, characterized by painless bright red bleeding during the third trimester. Performing a digital vaginal examination can disrupt placental attachment and precipitate catastrophic hemorrhage. Continuous fetal monitoring is essential to assess fetal status, while preparations are made for ultrasound confirmation and further management. Question 2. A 27-year-old prima gravida at 35 weeks gestation presents with severe abdominal pain, uterine rigidity, and dark vaginal bleeding following a motor vehicle collision. She appears anxious and reports decreased fetal movement. Her blood pressure is 88/54 mmHg, pulse is 124 per minute, and fetal heart tracing reveals recurrent late decelerations. Which condition should the nurse suspect first? A. Placenta previa. B. Abruptio placentae. C. Vasa previa. D. Uterine fibroids. Answer: B. Abruptio placentae. Rationale: placental abruption typically presents with painful bleeding, uterine tenderness or rigidity, fetal distress, and maternal signs of hypovolemia. Trauma is a major risk factor. The concealed blood loss may be severe even when vaginal bleeding appears limited. Immediate maternal stabilization and emergency obstetric intervention are priorities. Question 3. A nurse is caring for a pregnant client diagnosed with complete placenta previa at 32 weeks gestation. The client asks why she has been instructed to avoid sexual intercourse. Which response by the nurse is most accurate? A. Intercourse increases the risk for umbilical cord prolapse. B. Sexual activity may trigger placental separation and severe hemorrhage. C. Intercourse commonly causes fetal infection in placenta previa. D. Sexual activity increases fetal oxygen demand and worsens bleeding. Answer: B. Sexual activity may trigger placental separation and severe hemorrhage. Rationale: placenta previa involves placental implantation near or over the cervical os. Any vaginal penetration or cervical stimulation can disrupt placental attachment, resulting in life-threatening hemorrhage. Pelvic rest is therefore an important safety intervention. Question 4. A 36-year-old multiparous client at 37 weeks gestation is admitted with suspected placental abruption. Which assessment finding would the nurse expect to identify? A. Painless intermittent bleeding with relaxed uterus. B. Fundal height smaller than expected for gestation. C. Intense uterine tenderness with board-like abdomen. D. Fetal heart rate with reassuring accelerations. Answer: C. Intense uterine tenderness with board-like abdomen. Rationale: placental abruption often causes painful vaginal bleeding accompanied by uterine hypertonicity and tenderness. The uterus may become rigid or board-like because blood accumulates behind the placenta, irritating the uterine muscle. Question 5. A pregnant client at 34 weeks gestation is admitted with placenta previa and active bleeding. Which physician prescription should the nurse question immediately? A. Insert 2 large-bore intravenous catheters. B. Obtain baseline hemoglobin and hematocrit. C. Prepare for transabdominal ultrasound. D. Perform a digital cervical examination every 2 hours. Answer: D. Perform a digital cervical examination every 2 hours. Rationale: digital cervical examinations are contraindicated in placenta previa because they can provoke severe hemorrhage by disrupting placental tissue covering the cervical os. All other interventions are appropriate for stabilization and diagnosis. Question 6. A labor and delivery nurse is monitoring a client with abruptio placentae. Which fetal heart tracing pattern requires immediate intervention? A. Moderate variability with accelerations. B. Early decelerations during contractions. C. Persistent late decelerations with fetal tachycardia. D. Baseline fetal heart rate of 130 per minute. Answer: C. Persistent late decelerations with fetal tachycardia. Rationale: late decelerations indicate uteroplacental insufficiency. In placental abruption, impaired placental perfusion compromises fetal oxygenation. Persistent late decelerations combined with tachycardia suggest worsening fetal hypoxia and require rapid intervention. Question 7. A client with severe placental abruption suddenly begins bleeding from intravenous puncture sites and develops hematuria. Which complication should the nurse suspect? A. Hyperemesis gravidarum. B. Disseminated intravascular coagulation. C. Gestational hypertension. D. Amniotic fluid embolism. Answer: B. Disseminated intravascular coagulation. Rationale: placental abruption can trigger disseminated intravascular coagulation, DC, because thromboplastin released from the damaged placenta activates widespread clotting. This consumes clotting factors, leading to uncontrolled bleeding from multiple sites. Question 8. A 29-year-old pregnant client arrives with painless third trimester bleeding. Ultrasound confirms partial placenta previa. Which finding would most strongly indicate maternal deterioration? A. Maternal pulse increasing from 88 per minute to 122 per minute. B. Fetal movement felt by the mother. C. Mild anxiety regarding hospitalization. D. Blood pressure reading of 118/72 mmHg. Answer: A. Maternal pulse increasing from 88 per minute to 122 per minute. Rationale: tachycardia is an early sign of hypovolemia and hemorrhagic shock. In placenta previa, maternal blood loss may rapidly worsen. Early identification of hemodynamic instability is essential for preventing maternal collapse. Question 9. A nurse is educating a pregnant client diagnosed with marginal placenta previa about symptoms that require immediate reporting. Which statement by the client indicates understanding? A. I should report contractions with dark vaginal spotting only. B. I should call my provider if bright red bleeding occurs. C. Mild abdominal pressure is expected and does not require reporting. D. Bleeding is only dangerous if accompanied by pain. Answer: B. I should call my provider if bright red bleeding occurs. Rationale: bright red vaginal bleeding is a hallmark sign of placenta previa and may rapidly progress to severe hemorrhage. Immediate evaluation is necessary even if bleeding is painless. Question 10. A 31-year-old client with concealed placental abruption reports worsening abdominal pain and decreased fetal movement. Her uterine resting tone is elevated, and fetal heart tones are absent. Which nursing action is the highest priority? A. Administer prescribed oral iron supplements. B. Position the client supine for comfort. C. Initiate emergency maternal stabilization measures. D. Encourage ambulation to improve circulation. Answer: C. Initiate emergency maternal stabilization measures. Rationale: severe placental abruption can lead to fetal demise and life-threatening maternal hemorrhage. Maternal stabilization, including oxygen administration for fluid resuscitation, blood preparation, and emergency obstetric management, is the immediate priority. Question 11. A 25-year-old prima gravida at 36 weeks gestation is admitted with a diagnosis of placenta previa after experiencing recurrent episodes of painless vaginal bleeding. During assessment, the nurse notes that the client is becoming increasingly restless and reports dizziness upon sitting upright. Her blood pressure is 92/56 mmHg, pulse is 128 per minute, and skin is cool and clammy. Which action should the nurse implement first? A. Assist the client to ambulate to the bathroom. B. Increase oral fluid intake and reassess in 1 hour. C. Initiate rapid intravenous fluid replacement and notify the provider. D. Place the client in Trendelenburg position and obtain a urine specimen. Answer. C. Initiate rapid intravenous fluid replacement and notify the provider. Rationale. The client is exhibiting signs of hypovolemic shock secondary to hemorrhage. Rapid fluid replacement is critical to maintaining maternal perfusion and preventing cardiovascular collapse. Placenta previa can result in sudden massive blood loss even without pain. Question 12. A nurse is caring for a pregnant client with suspected abruptio placentae. Which laboratory finding would most strongly support the diagnosis of disseminated intravascular coagulation? A. Elevated hemoglobin level. B. Platelet count of 48,000/mm superscript 3. C. Increased serum calcium level. D. White blood cell count of 11,000/mm superscript 3. Answer. B. Platelet count of 48,000/mm superscript 3. Rationale. Disseminated intravascular coagulation is associated with thrombocytopenia due to consumption of clotting factors and platelets. Placental abruption is one of the most serious obstetric causes of DAC. Question 13. A client at 34 weeks gestation presents with severe abdominal pain, uterine contractions, and dark red vaginal bleeding. The nurse identifies fetal bradycardia on the monitor. Which intervention should the nurse anticipate? A. Immediate cesarean birth. B. Delayed induction after corticosteroid therapy. C. Discharge home with pelvic rest instructions. D. Vaginal examination to determine fetal station. Answer. A. Immediate cesarean birth. Rationale. Placental abruption with fetal distress requires rapid delivery to preserve maternal and fetal life. Fetal bradycardia indicates compromised oxygenation. Delaying intervention could result in fetal demise and worsening maternal instability. Question 14. A nurse is assessing a client with complete placenta previa. Which statement by the client requires immediate follow-up? A. The bleeding started suddenly this morning. B. I feel the baby moving normally. C. I had intercourse with my partner last night. D. The bleeding is bright red. Answer. C. I had intercourse with my partner last night. Rationale. Sexual intercourse can provoke placental disruption and severe hemorrhage in placenta previa. This information is highly significant because it may explain worsening bleeding and increase the risk of catastrophic maternal blood loss. Question 15. A pregnant client with abruptio placentae develops oliguria despite fluid resuscitation. Which complication should the nurse suspect? A. Acute kidney injury from hypoperfusion. B. Gestational diabetes mellitus. C. Pulmonary embolism. D. chorioamnionitis. Answer. A. Acute kidney injury from hypoperfusion. Rationale. Severe hemorrhage from placental abruption can lead to decreased renal perfusion and acute kidney injury. Persistent oliguria despite resuscitation suggests significant organ hypoperfusion and possible shock progression. Question 16. A nurse is reviewing risk factors for placenta previa with a group of pregnant clients. Which client has the highest risk for developing placenta previa? A. A 19-year-old prima gravida with no medical history. B. A 41-year-old multiparous client with previous cesarean births. C. A 24-year-old client with hyperemesis gravidarum. D. A 28-year-old client carrying twins without prior surgery. Answer. B. A 41-year-old multiparous client with previous cesarean births. Rationale. Advanced maternal age, multiparity, and previous uterine surgery, such as cesarean birth, significantly increase the risk for abnormal placental implantation, including placenta previa. Question 17. A client diagnosed with placental abruption reports severe continuous abdominal pain. The nurse notes that the uterine fundus feels rigid between contractions. Which pathophysiologic process best explains this finding? A. Relaxation of uterine smooth muscle from progesterone excess. B. Accumulation of blood behind the placenta irritating the myometrium. C. Excessive amniotic fluid stretching the uterine wall. D. Cervical dilation causing uterine fatigue. Answer. B. Accumulation of blood behind the placenta irritating the myometrium. Rationale. In placental abruption, blood collects between the placenta and uterine wall. This concealed bleeding irritates the uterine muscle, producing persistent rigidity and painful contractions. Question 18. A nurse is preparing a client with major placenta previa for cesarean birth. Which nursing intervention is most important before surgery? A. Encourage ambulation to reduce venous stasis. B. Obtain informed consent and ensure blood products are available. C. Limit fetal monitoring to reduce maternal anxiety. D. Administer methylergonavine to stimulate contractions. Answer. B. Obtain informed consent and ensure blood products are available. Rationale. Clients with placenta previa are at high risk for massive hemorrhage during delivery. Ensuring blood products are available is critical for rapid replacement if severe bleeding occurs intraoperatively. Question 19. A client with suspected abruptio placentae asks why the fetus is experiencing distress. Which explanation by the nurse is most accurate? A. The placenta is blocking the cervical opening. B. The fetus is receiving too much oxygen from the placenta. C. The placenta has partially separated, reducing oxygen exchange. D. The umbilical cord is compressed by excess amniotic fluid. Answer. C. The placenta has partially separated, reducing oxygen exchange. Rationale. Placental abruption decreases the surface area available for maternal-fetal gas exchange. Reduced placental perfusion compromises fetal oxygenation, leading to fetal distress. Question 20. A nurse is caring for a pregnant client hospitalized for expectant management of placenta previa at 31 weeks gestation. Which finding requires immediate reporting to the healthcare provider? A. Fetal heart rate baseline of 140 per minute. B. Client reports mild fatigue after walking. C. New onset uterine contractions with vaginal bleeding. D. Maternal blood pressure of 118/70 mmHg. Answer. C. New onset uterine contractions with vaginal bleeding. Rationale. Contractions in a client with placenta previa increase the risk for placental separation and severe hemorrhage. Immediate provider notification is essential because emergency delivery may become necessary. Question 21. A 33-year-old Gravida 5 Para 4 client at 35 weeks gestation arrives at the labor unit with heavy, painless vaginal bleeding. Ultrasound confirms complete placenta previa. The fetal heart tracing is reassuring, but the client continues to soak perineal pads every 20 minutes. Which prescription should the nurse anticipate first? A. Immediate vaginal delivery. B. Administration of tocolytics and discharge home. C. Preparation for emergency cesarean birth. D. Artificial rupture of membranes. Answer. C. Preparation for emergency cesarean birth. Rationale. Persistent active bleeding in complete placenta previa places the mother at high risk for hemorrhagic shock. Vaginal delivery is contraindicated because the placenta obstructs the cervical os. Emergency cesarean birth is often required to preserve maternal and fetal safety. Question 22. A pregnant client with abruptio placentae suddenly develops shortness of breath, tachypnea, and oxygen saturation of 86% on room air. Which nursing action is the priority? A. Place the client in high Fowler position and administer oxygen. B. Encourage slow, deep breathing exercises. C. Prepare the client for oral glucose testing. D. Limit intravenous fluids to avoid overload. Answer. A. Place the client in high Fowler position and administer oxygen. Rationale. Placental abruption can rapidly lead to maternal hypoxia due to hemorrhagic shock or coagulopathy-related complications. Immediate oxygen administration improves maternal oxygenation and fetal perfusion while further interventions are initiated. Question 23. A nurse is monitoring a client with placenta previa who is receiving expectant management. Which finding indicates that the current plan of care has been effective? A. Absence of further vaginal bleeding episodes. B. Progressive cervical dilation to 5 centimeters. C. Increase in uterine contraction frequency. D. Development of uterine tenderness. Answer. A. Absence of further vaginal bleeding episodes. Rationale. The primary goal of expectant management in placenta previa is prolongation of pregnancy while preventing hemorrhage. Lack of additional bleeding suggests stabilization and reduced immediate risk. Question 24. A client with severe abruptio placentae reports feeling intense abdominal pressure. The nurse notes increasing fundal height despite minimal visible bleeding. Which interpretation is most accurate? A. The fetus has descended into the pelvis. B. Concealed hemorrhage is occurring behind the placenta. C. Amniotic fluid volume is rapidly increasing. D. Placenta previa has resolved spontaneously. Answer: B. Concealed hemorrhage is occurring behind the placenta. Rationale: in concealed placental abruption, blood accumulates behind the placenta rather than exiting vaginally. Increasing fundal height and abdominal pressure suggests significant hidden bleeding, which may rapidly become life-threatening. Question 25. A nurse receives report on 4 pregnant clients. Which client should be assessed first? A. A client with placenta previa reporting painless spotting. B. A client with abruptio placentae and absent fetal heart tones. C. A client at 30 weeks with mild ankle edema. D. A client with gestational diabetes awaiting discharge teaching. Answer: B. A client with abruptio placentae and absent fetal heart tones. Rationale: placental abruption with absent fetal heart tones indicates severe fetal compromise or fetal demise and places the mother at high risk for hemorrhage, DC, and shock. Maternal stabilization and emergency intervention are urgent priorities. Question 26. A nurse is caring for a client admitted with suspected placenta previa. Which assessment finding most strongly differentiates placenta previa from placental abruption? A. Vaginal bleeding during the 3rd trimester. B. Maternal tachycardia and hypotension. C. Painless bleeding with soft non-tender uterus. D. Signs of fetal distress on monitoring. Answer: C. Painless bleeding with soft non-tender uterus. Rationale: placenta previa classically presents with painless bright red bleeding and a relaxed, non-tender uterus. Placental abruption usually involves painful bleeding and uterine rigidity. Question 27. A pregnant client with placental abruption develops anxiety, pallor, and confusion. Which physiological mechanism most likely explains these symptoms? A. Excessive fetal movement stimulating the nervous system. B. Reduced cerebral perfusion from maternal hypovolemia. C. Increased progesterone production during pregnancy. D. Elevated amniotic fluid pressure on the diaphragm. Answer: B. Reduced cerebral perfusion from maternal hypovolemia. Rationale: hemorrhage from placental abruption can lead to hypovolemic shock, reducing oxygen delivery to the brain. Confusion, anxiety, and pallor are classic signs of decreased cerebral perfusion. Question 28. A nurse is teaching a newly diagnosed placenta previa client about home management. Which instruction is most important? A. Perform daily vaginal self-examinations to monitor bleeding. B. Avoid strenuous activity and report any vaginal bleeding immediately. C. Increase physical exercise to improve placental circulation. D. Use tampons to accurately estimate blood loss. Answer: B. Avoid strenuous activity and report any vaginal bleeding immediately. Rationale: clients with placenta previa require pelvic rest and activity modification to reduce the risk of hemorrhage. Any vaginal bleeding should be reported immediately because rapid maternal deterioration can occur. Question 29. A client with abruptio placentae has laboratory findings of fibrinogen depletion and prolonged clotting times. Which additional assessment finding would the nurse expect? A. Petechiae and oozing from injection sites. B. Elevated blood glucose levels. C. Hyperactive deep tendon reflexes. D. Increased urinary ketones. Answer: A. Petechiae and oozing from injection sites. Rationale: fibrinogen depletion and prolonged clotting times are consistent with disseminated intravascular coagulation. Oozing from puncture sites and petechiae occur because clotting factors are consumed faster than the body can replace them. Question 30. A 38-week pregnant client with placenta previa suddenly experiences a large gush of bright red blood. The nurse notes maternal tachycardia and decreasing blood pressure. Which intervention has the highest priority? A. Obtain a detailed dietary history. B. Begin external fetal monitoring after lunch. C. Activate the obstetric hemorrhage protocol. D. Encourage the client to ambulate to relieve anxiety. Answer: C. Activate the obstetric hemorrhage protocol. Rationale: massive bleeding from placenta previa is a life-threatening obstetric emergency. Rapid activation of the hemorrhage protocol ensures immediate access to blood products, surgical intervention, and multidisciplinary stabilization measures. Question 31. A 29-year-old Gravida 2 Para 1 client at 32 weeks gestation is admitted with suspected placental abruption after complaining of severe lower abdominal pain and decreased fetal movement. During assessment, the nurse notes a rigid uterus and minimal dark vaginal bleeding. Which finding is most concerning? A. Maternal complaint of nausea. B. Elevated uterine resting tone. C. Minimal external bleeding despite severe pain. D. Fetal heart rate of 170 per minute with late decelerations. Answer: D. Fetal heart rate of 170 per minute with late decelerations. Rationale: fetal tachycardia with late decelerations indicates worsening fetal hypoxia and uteroplacental insufficiency. In placental abruption, fetal distress can rapidly progress to fetal demise, making this the most urgent finding. Question 32. A client with complete placenta previa asks why cesarean birth is necessary even if labor begins naturally. Which response by the nurse is best? A. Labor contractions increase the baby's oxygen demand. B. The placenta blocks the birth canal, making vaginal delivery unsafe. C. Cesarean birth prevents postpartum infection. D. Vaginal birth causes fetal malformations in placenta previa. Answer: B. The placenta blocks the birth canal, making vaginal delivery unsafe. Rationale: in complete placenta previa, the placenta covers the cervical os, physically obstructing fetal passage and creating a high risk for catastrophic hemorrhage during labor. Cesarean birth is therefore required. Question 33. A nurse is monitoring a pregnant client with abruptio placentae. Which maternal assessment findings suggest progression toward hypovolemic shock? A. Warm flushed skin and bounding pulses. B. Urine output of 15 milliliters per hour. C. Blood pressure of 122/78 mmHg. D. Respiratory rate of 16 per minute. Answer: B. Urine output of 15 milliliters per hour. Rationale: decreased urine output is an early indicator of inadequate renal perfusion caused by hypovolemia. Oliguria in a bleeding obstetric client signals worsening shock and requires immediate intervention. Question 34. A nurse is preparing discharge instructions for a client with stable placenta previa managed at home. Which statement by the client indicates a need for further teaching? A. I will avoid sexual intercourse. B. I should seek care immediately if bleeding occurs. C. I can perform heavy lifting as long as I feel well. D. I need to keep my follow-up appointments. Answer: C. I can perform heavy lifting as long as I feel well. Rationale: heavy lifting and strenuous activity can precipitate bleeding in placenta previa. Activity restriction is important to reduce the risk of placental disruption and hemorrhage. Question 35. A 37-week pregnant client with abruptio placentae develops sudden severe back pain and uterine hypertonicity. The fetal monitor shows prolonged decelerations. Which nursing action is most appropriate? A. Reposition the client to the left lateral position and administer oxygen. B. Encourage the client to ambulate to reduce discomfort. C. Delay interventions until contraction patterns normalize. D. Prepare the client for a vaginal examination. Answer: A. Reposition the client to the left lateral position and administer oxygen. Rationale: left lateral positioning improves uteroplacental blood flow, while oxygen administration enhances fetal oxygen delivery. These are immediate nursing interventions for fetal distress associated with placental abruption. Question 36. A nurse is caring for a client with placenta previa whose bleeding has stopped temporarily. Which nursing intervention remains essential despite the absence of active bleeding? A. Continuous readiness for hemorrhage management. B. Frequent ambulation to prevent venous thrombosis. C. Routine digital cervical examinations. D. Restriction of all intravenous access. Answer: A. Continuous readiness for hemorrhage management. Rationale: Bleeding in placenta previa can recur suddenly and massively. Emergency preparedness, including for access and blood availability, remains critical even during periods of temporary stabilization. Question 37. A client with severe abruptio placentae begins complaining of chest tightness and dyspnea. Her oxygen saturation falls to 84%. Which complication is most likely developing? A. Pulmonary edema secondary to massive blood loss. B. Hyperemesis gravidarum. C. Placenta accreta. D. Mild gestational hypertension. Answer: A. Pulmonary edema secondary to massive blood loss. Rationale: severe placental abruption may lead to shock, massive transfusion requirements, coagulopathy, and fluid shifts that contribute to pulmonary edema and respiratory compromise. Question 38. A nurse is caring for a client admitted with suspected placenta previa. Which action by a newly licensed nurse requires immediate correction? A. Applying external fetal monitoring. B. Assessing pad saturation and bleeding amount. C. Performing a digital cervical examination. D. Monitoring maternal vital signs frequently. Answer: C. Performing a digital cervical examination. Rationale: digital vaginal examinations are contraindicated in placenta previa because manipulation of the cervix can trigger catastrophic hemorrhage. Question 39. A pregnant client with placental abruption states, "I only see a small amount of bleeding, so the condition cannot be serious." Which response by the nurse is most appropriate? A. Visible bleeding always reflects the actual blood loss. B. Bleeding behind the placenta may be concealed and still life-threatening. C. Small amounts of bleeding usually mean the fetus is unaffected. D. Your symptoms are expected and not concerning. Answer: B. Bleeding behind the placenta may be concealed and still life-threatening. Rationale: concealed hemorrhage is common in placental abruption. Significant blood accumulation may occur behind the placenta without large amounts of visible vaginal bleeding, making the condition extremely dangerous. Question 40. A nurse is evaluating fetal monitoring strips for a client with severe placenta previa and ongoing hemorrhage. Which finding most strongly suggests worsening fetal compromise? A. Baseline fetal heart rate of 140 per minute with accelerations. B. Moderate variability without decelerations. C. Recurrent late decelerations with minimal variability. D. Presence of occasional fetal movement. Answer: C. Recurrent late decelerations with minimal variability. Rationale: late decelerations combined with minimal variability indicate uteroplacental insufficiency and fetal hypoxia. Ongoing hemorrhage reduces placental perfusion, placing the fetus at high risk for acidemia and death. Question 41. A 34-year-old client at 36 weeks gestation is admitted with complete placenta previa and active bleeding. The nurse observes that the client suddenly becomes pale and diaphoretic while reporting weakness. Which assessment finding would indicate the client is entering the compensatory stage of hypovolemic shock? A. Bradycardia and hypertension. B. Tachycardia with narrowed pulse pressure. C. Bounding pulses with flushed skin. D. Increased urine output and bradypnea. Answer: B. Tachycardia with narrowed pulse pressure. Rationale: during the compensatory stage of hypovolemic shock, the body attempts to maintain perfusion through sympathetic stimulation, leading to tachycardia and vasoconstriction. Narrowed pulse pressure is an early sign of circulatory compromise from hemorrhage. Question 42. A client with abruptio placentae develops severe abdominal pain and uterine rigidity. Which fetal assessment finding would the nurse anticipate? A. Variable decelerations with normal variability. B. Reassuring fetal heart pattern with accelerations. C. Fetal bradycardia and late decelerations. D. Baseline fetal heart rate of 130 per minute without changes. Answer: C. Fetal bradycardia and late decelerations. Rationale: placental separation reduces oxygen delivery to the fetus, often producing fetal hypoxia manifested by bradycardia and recurrent late decelerations. Question 43. A nurse is caring for a pregnant client diagnosed with placenta previa. Which intervention is most important to include in the plan of care? A. Frequent vaginal examinations to assess labor progression. B. Maintaining large-bore intravenous access. C. Encouraging upright ambulation every hour. D. Performing fundal massage every 4 hours. Answer. B. Maintaining large-bore intravenous access. Rationale. Clients with placenta previa are at risk for sudden severe hemorrhage. Large-bore 4 access ensures rapid administration of fluids and blood products if hemorrhage occurs. Question 44. A pregnant client with severe placental abruption states, "My pain suddenly stopped." Which interpretation by the nurse is most appropriate? A. Placental perfusion has improved significantly. B. Uterine contractions have resolved normally. C. Maternal shock may be worsening despite reduced pain perception. D. The fetus has descended into the birth canal. Answer. C. Maternal shock may be worsening despite reduced pain perception. Rationale. In severe hemorrhage, decreasing pain may indicate deterioration rather than improvement because reduced tissue perfusion and altered mental status can blunt pain perception during shock progression. Question 45. A nurse is reviewing laboratory results for a client with abruptio placentae. Which result requires immediate intervention? A. Hemoglobin semen kiste koxige decilitra. B. White blood cell count 10,000/mm superscript 3. C. Platelet count 180,000/mm superscript 3. D. Sodium level 138 MQL. Answer. A. Hemoglobin 7.2 G/DL. Rationale. A hemoglobin level of 7.2 G/DL indicates significant blood loss and impaired oxygen carrying capacity. Severe anemia in the setting of placental abruption requires urgent intervention and possible blood transfusion. Question 46. A client hospitalized for placenta previa suddenly experiences rupture of membranes. Which complication is the nurse most concerned about immediately afterward? A. Hyperemesis gravidarum. B. Umbilical cord prolapse. C. Gestational hypertension. D. Polydramnio. Answer. B. Umbilical cord prolapse. Rationale. In placenta previa, abnormal placental placement may prevent normal engagement of the fetal presenting part, increasing the risk for umbilical cord prolapse after membrane rupture. Question 47. A nurse is assessing a client with suspected placental abruption. Which maternal symptom most strongly correlates with concealed hemorrhage? A. Bright red, painless bleeding. B. Severe abdominal pain with minimal visible bleeding. C. Intermittent contractions relieved by rest. D. Absence of uterine tenderness. Answer. B. Severe abdominal pain with minimal visible bleeding. Rationale. Concealed placental abruption often produces severe pain and uterine rigidity despite little or no external bleeding because blood accumulates behind the placenta. Question 48. A pregnant client with placenta previa asks why fetal monitoring is being performed continuously. Which response by the nurse is most accurate? A. It allows us to identify signs of reduced placental oxygen exchange quickly. B. The monitor determines the baby's exact birth weight. C. Continuous monitoring prevents maternal hemorrhage. D. The monitor eliminates the need for ultrasound examinations. Answer. It allows us to identify signs of reduced placental oxygen exchange quickly. Rationale. Continuous fetal monitoring helps detect fetal distress early, especially when maternal bleeding may compromise placental perfusion and fetal oxygenation. Question 49. A nurse is caring for a client with abruptio placentae who begins exhibiting agitation, confusion, and air hunger. Which action should the nurse implement first? A. Administer prescribed oxygen immediately. B. Encourage oral fluid intake. C. Place the client in a supine position. D. Delay intervention until laboratory confirmation is obtained. Answer. A. Administer prescribed oxygen immediately. Rationale. Agitation, confusion, and air hunger are signs of worsening hypoxia and shock. Immediate oxygen administration is critical to improving maternal and fetal oxygenation while additional emergency interventions are initiated. Question 50. A 35-year-old Gravida 4 Para 3 client at 38 weeks gestation is admitted with severe vaginal bleeding caused by placenta previa. The fetal heart tracing becomes non-reassuring, and the client's blood pressure drops to 78/40 mm Hg despite fluid resuscitation. Which collaborative intervention should the nurse anticipate immediately? A. Delayed delivery until bleeding subsides naturally. B. Emergency cesarean birth with blood transfusion support. C. Vaginal delivery assisted with forceps. D. Outpatient monitoring after stabilization. Answer: B. Emergency cesarean birth with blood transfusion support. Rationale: severe hemorrhage with maternal instability and fetal compromise is an obstetric emergency. Rapid cesarean birth combined with aggressive blood replacement therapy is necessary to preserve maternal and fetal life. You just completed one of the most dangerous OB emergency topics tested on the Nclex: placenta previa and abruptio placentae. These are not simple memorization questions. The exam wants to know if you can recognize concealed hemorrhage, fetal hypoxia, maternal shock, DIC, and the difference between painless bleeding and painful bleeding under pressure. Always remember, placenta previa equals painless bright red bleeding. Abruptio placentae equals painful bleeding with rigid abdomen. Never perform a digital vaginal exam in suspected placenta previa. Maternal stabilization always comes before everything else. Late decelerations, minimal variability, and fetal bradycardia are red flags for uteroplacental failure. The Nclex will often hide the diagnosis inside fetal monitor strips, changing vital signs, shock symptoms, or subtle wording traps. But the safest nurse recognizes deterioration early and acts before collapse occurs. Keep practicing until these emergency patterns become automatic. Because in OB emergencies, minutes matter and priorities save lives. See you in the next high-level Nclex critical care session.